program. Okay, I think we're good. All right. Good afternoon, Onion Lake, and our podcast viewers, and just everybody on the internet. The people that tune in and follow some of our stuff. Welcome back to another episode. I have a couple ladies in here from our health department here in Onion Lake, and I'm actually excited to do this episode, and I'm actually glad that the ladies reached out and wanted to do this episode. Just for the viewers out there, I think today we'll be speaking around nutrition and diabetes, lifestyle and prevention, traditional and holistic approaches, and things like that. So I think before we get started, we'll have a quick introduction. I'll start to my right, or right across the table here, and then we'll come around to the left. We'll come back, and then we'll open it up.
Okay.
Okay.
All right. So my name's Alicia Oliver. I have been working in Onion Lake for 20 years as of October 2004. So it's been a very long ride, but I love it here. So we just wanted to, come and talk with you today about some things we're working on, things we've seen over the past few years, some initiatives we're doing, and just get the word out and see if anyone has questions or anything that they need from us.
Marilyn, thanks, Alicia.
Okay, and I'm Ashley DeBuscher. I'm also a registered dietitian. I've been at the Onion Lake Health Center since, I think like a year and a half now, almost 2 years. I am also one of the hockey coaches for Onion Lake Minor Hockey. We're excited to talk to you all about the different things we have going on, especially pertaining to youth in the community. So thanks for having us.
Yeah, thanks, Ashley. So I think we'll get into it now. I do have some introduction questions here. What is, maybe, I don't know if you guys touched on this already, but what is your role at the clinic?
So my main role would be working with the adult population, as well as infants. And so a lot of prenatal, postnatal care, infant feeding, that type of thing. My main role with the adult population would be working with those who have diabetes or other chronic conditions like high blood pressure, high cholesterol. I do cooking classes and group sessions on different topics, guest speakers in a lot of different capacities. So going to different places like Equiskeet for presentations, working with the prevention department here. What else do I do? I'm a certified diabetes educator. So we both work closely with Tanya Conacher, who's our diabetes nurse, who we will convince to come on as well at some point because she has a lot of information she can share too. And then I was finding it really overwhelming in Onion Lake on my own. So I reached out and asked if we could hire a youth dietitian. And that's how Ashley came into being. And she was also my student that helped me write a proposal for that. So it worked out in the end. She's the only one that applied. So she got it.
Here I am.
Nice.
I would do very similar things with Alicia. And then I focus more on the children and youth in the community. So same kind of stuff. So seeing patients from a day-to-day, working with the providers at the clinic for a number of different reasons. And then doing like class presentations. We're in and out of the schools lots. Like the kids cooking classes I've partnered up with Sports and Rec to put them on. And right now we've got a couple running each month at Eagle View, which is a lot of fun. Those kinds of things.
Nice. Okay, so I'm just gonna get into these questions here. Again, thanks for you guys' introduction, and I think Onion Lake is really lucky to have you guys here to help with educating and informing our community on this very important topic. So I think with that, just a general open-ended question when it comes to understanding diabetes. What is diabetes and what are the different types?
Okay. Do you want me to take that one?
Whatever. Yeah.
Okay, I'll roll with it.
Okay.
Okay. So there are a few different types of diabetes. The one that years ago was heard most commonly about was type 1 diabetes. It does account now for only about 10% of the cases of diabetes in Canada, but it's one where we used to see it a lot in youth. And it's one that the body has an autoimmune sort of attack on its own pancreatic cells that make insulin. So your body can't produce enough insulin to survive. So for those people, they have to take insulin or they will not survive. So that's one thing. So type 1, it's a small percentage. The other one is type 2 diabetes, which we see the majority of, especially here in Onion Lake. Type 2 is one where the body produces some insulin, but sometimes not enough. There's other things going on like hormone imbalances that create your stomach not signaling to your pancreas to produce insulin quick enough. There's all kinds of different organs that it kind of works with or kind of targets, I guess. And this one was commonly seen in adults. And over the past 20 years, like I said, I've been here for 20 years, and I think we might have had 2 clients that we saw way back that were maybe 13 years old that had been diagnosed with type 2. But now in the past even 2 or 3 years since Ashley's been here, basically right before she came, we've had an influx of youth, so age 13 to about 18, that have been diagnosed with type 2 diabetes, which was unheard of years ago. So it's very concerning. We do see a lot of another type called gestational diabetes. So that one is when parent or moms are pregnant, and usually later on in their pregnancy, they develop what we call gestational diabetes. And it's just from hormones that create your body to become insulin resistant. So your body doesn't respond to that hormone like it should. So their sugar levels start to creep up. And with that one, usually we work with these prenatals to help them get their blood sugar under control. Some of the risks with that is overweight babies. So the labor can be really hard on the mom, labor and delivery. It can make them have a low sugar after birth. There's lots of complications for the baby and the mom if they don't have their blood sugar under control. So we work closely with them as well. And then the other types, there's a few other different ones, but those are the main ones we would see.
In other words, I'm just trying to wrap my head around this. I know a lot of people in the community have heard the word a lot, and a lot of our family members are impacted by it. Type 1, type 2. Type 1 and type 2. So your body, like the food you eat, like say fast food, that would cause your insulin to go up.
Yeah. So
I believe.
yeah. So when we eat food, your body naturally produces insulin to take care of any what we call glucose or carbohydrate coming from the food. So typically the body responds by we have a stomach hormone that tells your pancreas to pump out insulin to get ready for the influx of the sugar coming in or the glucose. And then it carries it through the bloodstream and it will deposit that sugar into the cells for energy. So what happens with type 1, like I said, they don't produce any insulin at all. So they have to do it by injection to keep their sugar levels okay. For anyone with type 2, there's a bunch of different things going on. So some people might be on a multitude of different meds. Some people are on medications for their kidneys, for their liver, their stomach, like Ozempic, you probably heard of that one. Like some are on insulin, but it just depends on where they're at in their disease. It's a progressive disease. So you can start off with pre-diabetes. They used to call it borderline diabetes, but we know that it's like saying you're a touch pregnant. Either you are or you aren't. We know that, it's a progression. So we watch people when they start off with that in that stage, And then that kind of follows through to develop type 2. And then we try to prevent complications along the way. And that's why, some people think they're on too many medications, but actually they're probably taking better care of themselves because they're working on all the different areas that are affected by diabetes, not just taking one med and not really getting to target numbers. Does that make sense? It's kind of a confusing topic, but
Yeah.
Mhm.
Yeah. I remember. I'm just trying to remember. I'm just trying to remember. Like learning about this. Like coming up through the school system and stuff, and I can't remember right now, but like I know there was a simple way of understanding it. Like one is you don't produce enough sugar, and then the other one is you produce too much. I think
it's the insulin. So yeah, either you don't produce any at all or you produce too much, but your body's resistant to using it. And that actually is something we'll talk about in a bit too.
Yeah.
There's a symptom, an outward symptom, or should we just talk about it now?
Yeah, we can. Whatever.
There's an outward symptom of what we call insulin resistance. It's really important to watch youth for this, but even adults have it. It's a darkening of skin around the neck or under the armpits, under the knees, all of those areas. If you ever see like a darkening of the skin, it almost looks like your neck would be dirty or something.
Yeah.
But that's an outward sign of what we call insulin resistance. And that's a really early warning that your body has too much insulin being pumped out, but it's not working the way it should. So sometimes we see these people come into clinic, they get their blood sugar tested at our lab, but their blood sugar might look completely fine. So we have to actually measure their insulin levels. And sometimes they're like through the roof, these young kids. And some people are like, oh, their sugar's fine, it's okay. But their insulin levels are really high. So if any parents out there or adults see that darkening around the neck, I don't want to have an abundance of people swarming the clinic, but it's important, right?
Yeah.
Like we want to get the word out to get people screened if they need it. And that's one early sign we can look for. Yeah.
Cool. Awesome. Anything you want to add to that, Ashley?
If we're talking like warning signs of diabetes, there's some other things you can really watch for, especially in your kids and adults too. Everybody can be on guard kind of for these symptoms. So that would be things like experiencing like more thirst than normal. So if you find you're really, really thirsty, you're drinking lots of water, your body's just craving it, even craving things like pop and juice, and you're just craving lots of fluids, that can be a sign that something's off, and it's a good time to go get your sugars checked. Going kind of hand in hand with that, if you find you're peeing lots, so if you're getting up in the night a couple times, or if your child is like constantly having to leave class to go to the bathroom, that might be a good sign that to get the sugars checked. Other things would be like feeling really tired and fatigued all the time too. So if you're sleeping okay and you're still just feeling exhausted every day, that might be a great time to go get your blood sugars or your just blood checked in general. There could be a couple of things that could indicate. What are some other ones?
Sometimes even blurred vision can
yeah.
be one that we see. And when someone first gets diagnosed, their vision can be really blurred. But once they start their medication and we work with them on diet and things like that, we do see their vision start to improve. So all those little tiny vessels to the eyes and the kidneys are what we, and to your extremities, like your toes, all the small spaces, we want to protect all those really tiny, tiny vessels to keep them sort of healthy and not with the sugar floating in around them like syrup.
Yeah. Cool.
I usually have a picture that I use to teach diabetes. It's really hard just saying it because you can't see the visual.
Yeah.
It's a really complex thing. So hopefully people can kind of understand it a bit. But
yeah, and like Google too, right?
Yeah.
So if parents are concerned at home and they're not sure, and they want to do their own research, you could check on Google.
Yeah.
And
you just want to make sure it's like a good resource. You know what I mean? Like not something that's sort of.
And maybe we can share a resource even on the Onion Lake Health Center page.
Yeah.
We'll share one about warning signs of diabetes.
Yeah.
Mhm.
Yeah. Okay, so I have another question here. What are some common misconceptions people have about diabetes?
Okay, good question. Okay, I'll take the first stab at this.
Okay.
I think I think people might think that it like can go away. Like sometimes you will hear people talk about like, oh, I used to have diabetes. Generally, kind of, it's just like like being a touch pregnant. If you're either pregnant or you're not. If you've been told you have diabetes, that's not to say like some in certain cases like uh, things can improve, such as like diet and lifestyle, and you might find you get to a time where you maybe can like back off how much medication you're having, or but at the end of the day you still have diabetes. It's still within you. It's still something you need to be aware of and on top of and monitor, and yeah, it doesn't really cure itself. So that'd be like a misconception that we hear sometimes.
I have heard of some people, like Ashley was saying, like, I think I met a man at a conference one time. He actually changed his lifestyle so dramatically that he actually went in. I say it's more like remission in a way.
Yeah.
So he was able to keep the sugars under control for, I don't know how long. I haven't talked to him obviously since then, but he was an elderly gentleman, but he actually was able to keep his blood sugar under control with just diet and movement. And I don't know how long that worked for him, but he did really well when I had met him. And so, like she said, it might be like that for many years. And then, as you get older, your organs don't work as well. Things might start to happen where you need it again, but that's just based on your health and everything, right? So
Cool. So in other words, like say a young person, say like me, 40 and under.
How about 47? Just kidding. Okay.
Like let's say I had it type 1 or 2, and then I changed my lifestyle. I started eating better, hitting the gym. In other words, like what I'm hearing, I could be wrong. Like that doesn't mean you're cured from it. It's kind of just put to bed or just under control till however long.
And I mean, it could be when you're 80. You know what I mean? Like my grandpa developed type 2 diabetes when he was 80, I think 80, but it was just because he got older, right? So you might have a very long time in between. Who knows, right?
Yeah.
Like if you keep up your active lifestyle and your healthy eating, and it all just depends, right? But some people do such drastic changes that it does help them a lot. Yeah. So we don't want to give people no hope, but it's like learning how to kind of like, you want to live a lifestyle that you can keep up, not doing fad dieting or anything crazy like that. Do things that are healthy and what's the word I'm looking for?
Long term.
Consistent.
Yeah. Like habits, like you build habits, healthy habits.
Yeah. Lifestyle. Okay, so nutrition and diet for diabetes management. Next question. How important is nutrition in managing diabetes?
Well, in type 2, well, in most of them, I would say it's very important in managing your diabetes. Most people do require medication, but nutrition is definitely, I would say, one of the most important sort of ways to keep it under control. So that would be watching how much you take, how much food you eat that has carbohydrate, whether it's like quick carbs or quick sugars, we call them. Trying to like cut out added sugar, like things like that will really help. But having said that, there is still a genetic component. So people that are First Nations are automatically higher risk, and they don't know why that is. It's same with Hispanic and Black, like African American, same thing across the board. Like there's, for some reason, there is that ethnicity that does create a higher risk, but there's other things as well, just familial history. Like if you have, an immediate family member that had diabetes, if your mom had diabetes when she was pregnant with you, even like if you were an overweight baby when you were born, even sets you up for high risk. So I don't know what the original question was now because I'm rambling, but
no, those are some good points. Like going back to nutrition and the history, right? Like just through observation in my own mind, and I don't know this for a fact, but like our diet way back, all these generations and wild game, lean meat, and whatever else, right? And then being introduced to like fast foods and processed foods and sugar and things like that. I don't know why or how, that would impact like a First Nations person along the road somewhere in history in
Mhm.
that way, you know?
Well, and I think because years ago there wasn't a lot of carbohydrate. So
Mhm.
when you look at the main macronutrients that make up a diet for energy, it's carbohydrate, protein, and fat. Those are the three main ones, right?
Yeah.
So in the First Nations diet, like your ancestors probably likely had a lot of abundance of protein from the meat, right?
Yeah.
And, small amounts of healthy fat, maybe a little bit of carb from like berries. Trying to think of other sources.
What would carbs be today?
Carbs
Like
today, which is something I
spaghetti.
probably should have started off with. So carbs today would be Ashley, you want to take it away?
Sure.
Well,
So-
sorry, I'm just taking over
Yeah,
here.
no,
Like I'm
it's
Okay.
it's
I
cool. This,
ramble.
this is really good.
Okay,
Like, I'm
good.
really glad we're having this
Okay,
convo
good.
on air like this.
Yeah. So carbs. So this would be like the foods that when we eat them, they break down into sugars in our stomach. And that's not to say that like you should cut out all carbs. We're definitely not encouraging that, but it is something that we'd want people to kind of enjoy in moderation and just be kind of more mindful about them, especially when it comes to like preventing diabetes or eating. As somebody who has diabetes, both is good to be aware of. So there's a couple different like kind of categories of foods that contain carbs. That, and again, that's foods that break down into sugars once you eat them. So that'd be all of our grains and starches. So everything from bread, pasta, rice, potatoes, we even kind of consider in that category too. Some people think of them as vegetables, but they really act like carbs in our body. Same with so bannock, any kind of flour, any kind of baked goods, muffins, cookies, pies, cakes, you name it, everything, anything grain will break down into sugars in your stomach. Same with fruits, and I feel like that kind of makes sense because they taste sweet, right? So if something tastes sweet, it's usually like a good sign that there's sugar in it.
Yeah.
And that'd be like pretty well all fruits. And again, we're not telling people to cut those out. Fruits are really important. Probably across the board, we could all be eating more fruit even too. And then the next category would be like dairy products. So they actually contain carb as well. I think most people are kind of familiar with the term like lactose. You'll hear lots of people that are lactose intolerant, or sometimes they just say, "Oh, I'm lactose." That's
Yeah.
often something we hear, which is kind of cute. So lactose is the sugar that's in milk. And again, it's full of like awesome other things. So we are definitely not telling people to cut this out, but just something to be mindful, having your glass of milk, but don't drink the whole liter, like that kind of thing. Same with like yogurt is a carb. And then all sweet stuff. So any kind of desserts, honey, brown sugar, whatever you're putting in your coffee and tea, like all of those are still sugars. It's not like one is better than the other. Any kind of pop, juice, all of that are also sources of carb, and something to just be kind of careful not to overdo.
Yeah.
There's the other thing too. What was I going to say now? Yeah, those foods, basically, when we do see people, a lot of times the diet mainly looks like carbohydrate and maybe some meat. And I know that might be related to food insecurity and not having availability of vegetables and fruit, whether it's frozen, fresh, canned, but that is something we commonly see. So that's what we mean by watching, kind of, being mindful of how much you're eating, because potatoes are cheaper, or, grains a bit cheaper than something else. But we're trying to teach people how to use, cheaper ways of getting produce to kind of balance that out.
Yeah.
Because, and then the other things that we know people overdo is usually juice and pop.
Yeah.
Hugely, like
Chips.
Yeah. And just, we want people to, even the community as a whole, to start working. And I've seen this over the years sometimes where at events they offer water, or like, we need to start doing things where we work as a whole community in offering healthier options, because that might be the best meal someone gets in a whole day. We know there's a lot of food insecurity. We've done studies on it. We've heard it from people over the years, and it's a huge issue. And we even saw it during COVID big time. So just, I think as we host events in the community, trying to be very mindful of what we're providing, maybe making sure we have vegetables in that food, fruit for dessert instead of cake. Why do we need cake?
Yeah.
Just being, using our money towards the good to support healthy growth.
Yeah.
Having like diet pops available at community events, like the Winterfest meals and stuff, that diet pop should be available for.
Yeah.
And should pop even be available?
Yeah.
Like at that point, if we know that this is an issue and like
waters. I mean, we have a great water source also. Eugene would tell us to really pump that up,
Yeah.
but we do have a safe water system. And we talked about, sometimes people don't like the taste of it in the spring or whatever, but like I use a Brita at work. It's awesome. It just cleans out, like it makes it taste amazing, and it's safe, and we don't have to pay for that. And people are struggling with the price of groceries. So that's one way to save on money, is not buying pop or juice, right?
Yeah.
It's huge money savings.
Totally. Yeah, I know. I'm just listening to you guys talk, and I feel the passion and the message you guys are coming to share. And for me, my guilty conscience, like man, like I know just from listening to you guys and your recommendations, my own personal diet, is really not good compared to what you guys are talking about. And kind of just a little background, I guess. Like I do go to the gym. I try to go daily if I can. It really helps me with managing stress and things like that. And we actually had a nutrition challenge at the gym just after New Year's here, and I think they're wrapping up at the end of this week, I believe, unless it was last week they did. It was an 8-week challenge. I signed up for that and I actually didn't follow it because I'm not there yet,
Yeah.
But the information in the group chat that we had was really good. They talked about macronutrients and water consumption and weighing your food, grams, how many grams of protein and fats and carbohydrates, and then the percentages on the macronutrients to try and hit for this challenge. So I kind of followed along that way, and I was trying to just consume the knowledge being shared. I didn't actively participate, which I'm not proud of. But it is on my radar. But one thing I realized from going to the gym and doing CrossFit for the past couple of years, the program itself is really hard physically. It's physically demanding, high intensity interval training, and in my mind, like I think like I should should look like a model, and I should be in the best shape ever. But when I look on the scale and in the mirror, it's like still the same person, just less fat overall, which I'm proud of. But one thing I realize, and I'm realizing more and more every day, is the most important part of the whole health thing is the diet. So weight management, everything I think stems from there. And everything you guys are talking about with the diabetes stuff, it just, in my mind, it just takes me back to my own trying to lose weight, my own weight loss journey, and trying to maintain healthy, habits and stuff. It sounds like what you guys are discussing or what you guys are bringing here falls into that. But it's funny that my mindset is like performance and endurance and things like that. But on a basic level, like it's like managing diabetes,
And I think too, like the way we teach sort of portions and trying to teach people about carb amounts to have, it's just like we would teach anyone. Diabetes is no different. If you have diabetes, we don't want to tell you can never have a piece of pie again. That's not what we're here for. We're here to help you figure out how to eat that little bit of pie and not make your sugar spike. Like, we don't want people not to live life and enjoy food. The word diet actually stems from the word dieta, which is way of life. We want people to live life and enjoy it. And diet shouldn't be such a negative term, but it's become that over the years.
Yeah.
We don't want to think fad diets. Like I said, we want to think about sustainable things. And you said you're not ready for the nutrition piece, but things come with time. Like, it's habit forming, right? You don't want to just go all in and do everything all at once, or it may not stick. So just adding little habits, maybe starting to have like one vegetable at every meal for supper, you know, like tiny things that are doable and easy, smart goals is better than trying to do it all at once, I think.
Yeah.
Absolutely. Like going all out for, you know, that month would have been like, okay, that's fine. But is it something you could continue doing consistently? And probably not, right? It sounded like it was going to be kind of restrictive. And yeah, I think like a part of coming to see a dietitian, like I think sometimes people think like it can be kind of daunting. That we're here to judge you, that we're going to be a diet police, that kind of thing. Like we hear that kind of stuff all the time.
People run from us in the grocery store. I'm
Yeah.
like, come
Oh,
back
yeah.
here.
Yeah.
Look at my cart. Look
Yeah,
at my
it's
cart. I
fine.
have like what you have. It's
Totally.
fine.
We're not perfect, you know.
No.
And I think working with us to like one of our kind of goals is to help make nutrition like make your nutrition better wherever you're at. So meeting you where you're at. And you know, we wouldn't take somebody who from like here and put them here, you know, we wouldn't
Yeah.
like all of a sudden put you on a bodybuilding crazy regimen
Yeah.
where you have to be weighing out your lettuce and that kind of thing, you know.
Yeah.
But yeah, exactly, like making these small goals for yourselves that are like attainable and is contributing to your health overall. And maybe yeah, it's the little things that you can do.
Like we
Yeah.
often don't even weigh people. Like
No.
people think that's crazy, but we don't weigh people unless they want to be weighed. We don't even look at a scale. You know as much as we do because you've been talking about your journey, but when you work out and you're building muscle actually weighs more than fat.
Yeah.
So if you're just standing on a scale, you might freak out because you've gained weight, but that doesn't mean it's a bad thing. We know from how we fit our clothes, from how we feel from the inside out, you don't need a scale to tell you that. So the only time I would use it is if someone's using or losing weight unintentionally, like say someone's got an illness and we want to make sure they're not losing too much, that's when we would weigh them. But otherwise, I don't really use a scale unless it's for infants or
yeah, unintentional weight loss.
yeah.
Yeah.
Basically that's it. Unless someone wants it and then we will.
Yeah, just on the point you guys touched on, like kind of building over time, building the habits and stuff. That was kind of my mindset when I joined the gym. Like the reason why I joined the gym was my health really took a turn in the past few years. Being a part of, you know, chief and council and you know, a lot of meetings, a lot of sitting, a lot of mental labor thinking, and then the food that we eat while in those positions or when we're away for meetings and stuff, they're not always the healthiest options. So for myself, that I think that caught up to me. I know, like, again, I put on a lot of weight and I just wasn't active at all. I was really mentally exhausted, physically exhausted just from sitting all the, you know, all those the whole time. So I wanted to change that. So I joined a gym and I found a program that I enjoyed. And initially, like even now, like it's been 2 years, but to me, like the whole idea was just to start moving my body, getting my blood flowing, and building like the internal strength to make better decisions. So I think 2 years later, I feel a lot better now. I feel a lot stronger and more confident to start making those progressive steps towards making conscious decisions about my diet, my sleeping and things like that, you know. So like you guys said, like the progression over time, you know, like I wouldn't have been able to like you said, like go from here to here in one day, like a light switch. So yeah, so I can like agree, I guess, or feel what you guys are saying on that point.
Yeah, it definitely is a progression. You can't just, I mean, some people can. Some people have that personality where they just, it's like quitting smoking cold turkey. They just quit it. You know what I mean? And others, food can be an addiction too, right? So we sometimes feed our emotions. Over the years, one thing I've noticed as well, I think it's a result of, you know, residential schools and that kind of thing, all the negative effects. A lot of people we work with that are, you know, in their 60s, 70s, I would say, especially with youth, I've noticed this over the years. A lot of grandparents will, like Googums and Mushums, will feed their grandkids a lot and sort of not overstep, but they want to give them as much love as they can. So they give them whatever they want in the form of food.
Yeah.
And it's a sign of love. It's
Yeah.
meant because they want to show their love, which I think is amazing. But at the same time, that's one thing that can be harmful, right? So then with these little ones, drinking pop and having a bunch of treats and, things that are meant to be every now and then become an everyday food.
Yeah.
So trying to work with people to figure out, other ways to show that. And it's hard. It's psychological, right? Like that's not my cup of tea. I don't know how to teach that, but I think that there needs to be more, psychology also mixed in with that. Like, like to work with more mental awareness and why we eat the way we do. It's linked a lot of times to trauma, and just being aware of that is really important too.
Even using like food as a reward with kids. I think that's really common, that like, oh, you did good on your test, let's go for ice cream, or oh, you came to the health clinic, okay, let's go get a pop, that kind of thing. And I think that like kind of builds that habit for later in life too. Right now, once the kids grow up and they're adults, and it's just not a very healthy thing to be. There's like other ways you could kind of treat yourself for succeeding in areas or something.
And I don't know what, I'm not a parent, so I don't even know what to recommend, but you know what I mean? I've just seen it, and I know it's out of the goodness of people's hearts, and that's where they're coming from. And I just, these young ones are so adorable, and they'll take it. If I was offered that stuff, boy, I would. When I was younger, like we were allowed one snack on a Sunday. We'd go to church, and I was allowed either one bag of chips or a can of pop, nothing else. And that's all I would get once a week. But now it's like an everyday food for a lot of people, right?
That's true.
But it's empty calories. There's no nutrition. Like we want nutrient dense food to build healthy bodies, not, just fat and carb and no vitamins. None of the little building blocks we need for kids to eat.
Yeah, totally. Like I think another kind of challenge, and like I'm glad we're having this discussion, because I could see it, and I think a lot of us see it, especially like our generation and older. Like even me, for myself, when I was a kid, back in let's say the 90s, on the reserve here, things were a lot different in terms of kind of where we're at, I guess, financially in as a community, and just like acquiring assets and whatever else along the way. But yeah, like you said, like I remember my mom and my dad, like they would go to bingo, and they would come back, not all the time, but however often, they'd come back with like KFC or Subway or something, and so but fast forward to today, like our kids, my baby, like she's a 3-year-old, my 3-year-old daughter, like she can get all the pop and the chips and whatever else, like in a snap of a finger. The store is just right there. Financially, I think we have that little bit of more than back in the 90s as a community. And like you said, like the googums and mushums, like I know my mom and my dad, my mom especially, like spoils my baby, and she'll give her whatever she wants, and like you said, out of love, right? And so like I think that's a part of the challenge with what we're seeing today, the trends that we're seeing. Also, I had another point, but I forgot. But like there was a question that I did want to ask. I think I'll just ask it now. Could we touch on the study that was done recently and the results on that? Just so the viewers know and the families know that like we're not just speculating, and we're not just grabbing ideas out of thin air. So
absolutely. Okay, so last fall we partnered, we being the health center, partnered with researchers and physicians from the University of Saskatchewan. We worked with the pediatric diabetes team at the what is the new
Well,
Jim
the Jim
Patterson?
Pattison,
Jim Patterson Hospital.
Yeah.
And we did a study. We were looking at blood sugar levels in the grade 8s at Eagleview. And we also, so it was kind of a 2-part thing. So we came and we did education with the students and the teachers for a day. We spent a day doing like different activities that to just discuss and educate everybody about diabetes, give them kind of just basic knowledge and understanding. And then the second day we came back and we actually tested some blood sugars. So we did, it's called the dried blood spot screening. So it's really simple. It's like kind of a special piece of paper, almost looks like a little business card kind of. And we had our nurses from the clinic set up in the library at the school, and they just poked the kids' fingers, the kids who had their consent forms signed, obviously. We're just randomly doing this, but so you poke their fingers. It's pretty chill. It's just a little poke, and then you put spots of blood onto a little, like a business card, basically. We sent it away to a lab. I think we only studied 23 kids, I want to say. And we found like 1 in 5 had either prediabetes or type 2 diabetes. We diagnosed it was a crazy time period there. So many kids were being like diagnosed with prediabetes and or type 2 diabetes. And, these are kids that would be like 13, 14, 15, like kind of probably more 13, 14, right? Or 14, 15, maybe even.
Yeah, some of them were
there.
ranged from
like early teenagers.
Yeah, like
so
young.
They usually screen, like years ago they said, you shouldn't screen unless there's cause to do so. But we know we work with a population, like in this community, there is higher risk, like I mentioned, with being First Nations, but also other risk factors, like having a lot of relatives that have type 2 diabetes. So it increases your risk automatically. The other thing I wanted to mention too is it's not always related to weight. So that's one misconception, is that only children who are overweight develop type 2. That's not the case. We've seen healthy weights that have had high sugars. That is not going to be, you don't just want to screen only children that are overweight. There's a lot of kids that we screen that doesn't matter their size. So
we were having athletes, like student athletes, young athletes diagnosed with diabetes too. It's like, it doesn't matter weight wise, activity levels. I just did like a quick math here. So we found like around 20% of the students we tested had either prediabetes or diabetes. There's around 1,500 students in school here in Onion Lake. So that would be about 300 kids potentially.
Holy.
If you like take those numbers and expand them, kind of 300 kids could be walking around with prediabetes or type 2 diabetes.
And the issue with that, another thing we didn't mention, but with children who develop type 2 diabetes in youth, what happens is the progression and the risk they have for complications is much greater for because they have the disease longer than an adult would, right? So all the damage to the vessels and everything that can happen with an adult, it's starting earlier on. And they also know it's more aggressive in youth, meaning if for some reason they don't know why, it actually affects them more than an adult. So they're still doing studies on that, but it's really scary to think that we have these young kids that are, just, we don't have the support. Like, we have a lot of supports in Onion Lake. We're very lucky at health. We have 3 of us are diabetes educators, like Ashley, myself, Tanya. We have diabetes, a core team, and we're pretty easy to get into. We're busy. Like we said, we do a lot of different things, not just diabetes. So people have to realize that sometimes. But when you think about it, like, we may not even be able to keep up with that demand for support if it's that high. And that's only one grade. We didn't test the ones that were already in grade 9, 10, 11, 12. You know what I mean? Like, it's actually really shocking. We were shocked.
Is there a way we can test? Like,
we can.
Could we make that like a regular thing? Is there a cost to that, or what would be the barriers to making that a regular practice in the school system, just to monitor that?
We actually are hoping to do that. We haven't set a time or when. Probably, I would think in the fall is my idea. We'd have to talk to Tanya and with Albert and everyone else, but after this study, we know we have to do that, because we don't want communities screening when they don't have any supports available necessarily, because they set that family up to have no support. So say, far up north, if they were doing the same thing, if they all of a sudden had these kids but no dietitian or nurse to work with, it would be very risky. Like you're
Mhm.
kind of not doing the best thing, right? So
Mhm.
we want to make sure if you're screening, you have the supports in place, and we do. So we want to start doing it regularly, probably with that same age group. And maybe we were thinking a couple years older
Mhm.
because we've missed that sort of group of kids,
Mhm.
and just do that every year and just keep doing it.
Yeah. The awesome thing is too, so for all the kids that we caught that have prediabetes or had prediabetes at that time, it is kind of reversible at that point. I know we talked about how diabetes isn't reversible, but having like at or when you're diagnosed with prediabetes, if you make some changes, sometimes there's medications involved, oftentimes there's not. You know, maybe that means like taking pop out of the home, reducing how much you're eating out as a family, or making sure physical activity is more important as a family. Some of these kids, their levels can drop back down to normal, and
And we've seen it.
yeah, we see it. It happens. So having that early detection of, oh, your 13-year-old has prediabetes, like this is a wake up call for the whole family. Versus like, you know, catching them at maybe 19, like, oh, now you just have diabetes, you know,
Yeah.
whereas this could have been preventable for 5 years. So,
And we have like families. The other really complex issue too that we've been coming across is, and I don't know if this is the case for everyone, but these youth that are being diagnosed, often their parents or their grandparents may also have diabetes.
Mhm.
And you know, there's different stages of change when you have a diagnosis. So you might start off like, you know, angry. Why do I have this disease? You know, like people might still be in denial of their own diabetes.
Yeah.
And then for them to now have children with the same issue, it might be a lot for them mentally to deal with as well. So like we haven't quite figured out how to support them that way either, but that's going to be another big issue down the road, I think, is working with complex family dynamics and trying to give support. Whereas some have really great support and they seem to be doing really well. So it just depends.
Yeah. Yeah. So by the sounds of it, the diet and the nutrition is like the top priority, especially early on with 18 and under kids. But even as adults, for us, taking that responsibility and that priority, maintaining that priority with the food consumption and monitoring your food intake, processed foods, fast foods, and things like that. Um, yeah, and in that, I guess initially is like common sense, and like the cost of it, like it on the, I don't know how to say it, but it sounds like a really easy thing to manage and prioritize, but when you're actually living the day-to-day your life, you're not always mindful of that, and you know, you don't plan ahead, you don't with your food. So like for myself, you know, I'm just trying to look at my own life in this whole discussion. Like I should be food planning, and I do, but I don't always follow it. So a lot of times what I do is like I'll come to work, let's say, and in my mind I'm like, okay, I'm gonna lower my food intake, so I'll skip lunch, and then it'll all come back to bite me around 2 o'clock.
Totally. Yeah.
So now I wanna, whatever's around me, I'm gonna eat, right? If there's a cake or if there's KFC or whatever, pop, yeah, and then I'll end up binge eating. So it ends up working against me, my strategy that I haven't learned from yet, over all these years. But I think there's a lot of people kind of in that similar kind of area. Again, like the cost of food, like for myself, it's manageable, but you know, like you look at our community, you know, the bigger families and stuff, like it's not always easy to shop for the foods that we need and then to maintain that, because they spoil, they don't have a long shelf life and things like that. So I think the challenges are, there's a lot of challenges or barriers to maintaining healthy food consumption.
Yeah.
So I think we could segue into the next portion with food security and sovereignty initiatives, some of the things you guys are working on. So I'll
Okay.
be quiet.
So food security, for a lot of people, they may not know what that term refers to, but it's having access and availability to healthy foods for all. So just making sure that people can access the foods that we know sustain healthy lifestyles. We know that it's a huge issue in Onion Lake. We did a study with, it was called the First Nations Food Nutrition Environment Study back in 2017 or 18, I believe. And they tested for different things like mercury in the hair, like in the water sources. Like they did a lot of meat sampling, stuff like that. It was actually really interesting. But we also did like a household survey, and I think there was 78 households that completed it. And what we found was that 43 or 45%, I can't remember the number now, it was over 40% of households were food insecure, meaning they didn't have access to healthy foods. The other thing is that a lot of them were severely food insecure. I think it was 13%. And that means they go without a whole meal because they have no access to food. I've met moms over the years where they forfeit eating to feed their babies and their children. It's a really big problem. We don't have a grocery store necessarily here. Like we have some foods, but not a lot to provide that healthy, alternative to eating convenience food. So that's a real issue. There's kind of 3 areas you can work on in food security for initiatives. I like to break it down for people because it's kind of complex, but the one is called short-term relief. That would be things like the food bank that we have here, or soup kitchen, things that feed people and they get immediate benefit from it. Or like we do prenatal food coupons for Macao Mall, or they can use it for a fresh food box once a month if you're pregnant. And so then you get those foods that way. So it's like a Band-Aid solution in a way.
It doesn't
right?
address the root cause
Yes.
of why that person is
Yeah.
hungry at that moment.
Right?
But
So
here's
it's
food
still
for this
good.
moment. But it's still good. We
It's
still
still
need
good.
it.
Yes. But ultimately, food security would be if we did not have a food bank. If we did not
Mhm.
have to have one, that is true food security.
If all
right?
homes had access.
If all homes had
if all
food.
people had food.
So it's sort of one of those things that we do just to get by so people aren't completely going without.
Yeah.
The second stage, or the second kind of area we can work in, is called capacity building. So it's more skill building. It's teaching people how to self-sustain in their homes, or, teaching how to do gardening, or budgeting workshops, grocery store tours, cooking classes. All of those things build skills. And so that gives people self-efficacy or empowerment to do their own food prep. And then the third one, which is often the hardest, but it takes a whole community, is system redesign. So system redesign is sort of looking at it at a public health level for prevention. So more like looking at barriers, like you mentioned, like maybe transportation's an issue, or making food like easily accessible. But how do we do that as a whole community? So Ashley and I have been talking for a long time, and I've been thinking of it over the years, and speaking with Mary Wynn Carter, who we know is like a lifelong volunteer and committed community member. She is amazing, and she doesn't want me to say that ever, but she is. She's unreal what she puts into this community, and I don't know if it's recognized, but she's unbelievable. So with that, we have this vision of sort of a food hub, like kind of an area somewhere in the community. We don't know where yet or what that will look like, but we've brought it forward and we're working on proposals for it to have a food center with teaching kitchens inside, maybe a commercial kitchen for providing food to all of the different group homes and, all the different centers health manages, but also others that might need it, like daycare. So you wouldn't need, you could have more centralized cooking, and then it just is carried out from there. The other thing would be the food bank could be part of that. That's all inside, like a walk-in cooler or freezer. We know after COVID, we have very limited storage of cold or frozen foods in this community. We had to set up the entire high school at the time, like Eagle View, as a huge food center. Like I was spending thousands of dollars every couple of weeks or every week to feed the community, those that were isolating. And it was a lot of work, but we did it and we made it happen.
Yeah.
But we learned from that, like that's scary, not
Yeah.
having access, right? The other thing, that food hub would be an area for garden spaces, like outdoor gardens, big gardens, maybe an orchard area. What else? Meat processing plant down the road. I know they've had talks about that in the past. So trying to have everything related to food in one area for people to go to.
Yeah, and in doing so, with any luck, that improves food security. You know, this is a space where people can drop in and like get rid of their extras if they have extras of something. Like there's talks of like trying to get a community freezer program going, where if you are a hunter and you know, you've filled your own deep freeze, now you can fill this one. And people who maybe don't have access to that type of food or access to hunters or couldn't get it otherwise could stop in and grab some and for their own homes and that kind of thing.
Yeah. And we want the traditional piece as well. So we want, you know, to have like a smokehouse and, you know, so we can do dried meat and have an outdoor kitchen. So we're more outside and like just a bunch of different.
Yeah.
We have a vision, but it's a big vision, but I don't know. We'll keep chipping away at it and see what happens.
Yeah. And I think that's perfect timing, like especially what's going on politically on the national level and the international level, the tariffs and stuff like that. Like when you mentioned COVID, when we had the roadblocks and stuff like that, you know, yeah, like scary times. So I think positioning our community with what you guys are doing and supporting that would help. Like the different levels you guys identified. So yeah, I'm really glad that we're having this discussion and raising the awareness on some of the work that you guys are doing. And highlighting how important diet is, especially when it comes to like diabetes and stuff like that. But yeah, like I just kind of wanted to go back again to that study and the results and the findings in that. I think that's really alarming, and I hope, like even for myself as a parent, I hope it, you know, like Ashley said, like the wake up call to be more conscious with what we're feeding our kids or when we go shopping and the items we're selecting. And just to, I guess, try be more knowledgeable in the area. Yeah, so I'm really glad that we're having this discussion. I think it's really important, and yeah, I have some more questions here. I don't know how much time you guys have. We are 58 minutes into this. The next set of questions I have revolve around lifestyle and prevention. If you guys want, we can get into this, or else we can schedule another episode if you guys want. I honestly, in my opinion, just from looking at our numbers and stuff and the engagement, I think people in the community are enjoying this discussion, shedding light and you know, sharing the education around it. And in my mind, I think you can never run out of things to talk about in nutrition and diet and things like that. Healthy living, healthy lifestyle. And yeah, I for one am hoping we could do this more or even on a regular basis. I know Vanessa with OLFS, the Triple P program. We're trying to do that every couple of weeks, where we just talk about parenting and different age groups and all the different, like there's so much to talk about in there. And I feel like this is another topic that's kind of the same way, like you just never run out of things to talk about.
It's true. We just did a presentation for the dental school, like the school dental program, with some of their workers in Saskatoon, and just there was so many things. We were like, oh, we could talk about this, we could talk about that. Like there's scurvy up north. Why is that? That used to only happen when there was sailors and you know, back in the day. But now we're seeing it in everyday life for people. So
Mhm.
we could talk about scurvy. We have high rates of iron deficiency anemia in this community, really high rates. That's another big issue we'd see a lot in nutrition. Yeah, there's tons. We could talk for days, but we can do that. We can just schedule more
Make it
regular.
more regular. Yeah.
Yeah.
Totally.
Yeah, I think the people enjoy it. I enjoy it. I
And we
love
like
it.
to hear ourselves talk. No, I'm just kidding. We
Yeah.
don't typically.
And I
but-
think the more we do it, I think the more
Mhm.
people will feel comfortable to want to engage and ask questions. We do have questions. I mean, some comments up there. One from Juanita when we're talking about Google, and then another one from Trista, acknowledging Alicia. So, yeah, I think more parents over time, if we keep doing this,
Mhm.
I think we'll have more questions up
Yeah.
there.
And that was a really good group. I know Trista mentioned it too when she did her podcast with the students she was with, or her group.
Mhm.
And that was an amazing program. And I think more of those programs would be awesome.
I agree.
It's just so inspiring. And that group was just awesome. And I worked with them for the 4 weeks and I loved every
Oh,
minute of
really?
it. Yeah.
Mm.
They were
Nice.
really a good group and so dynamic, like so different,
Yeah.
you know? And Georgette was talking about that day
Yeah.
too. And it was just so fun to hang out with them. And they had so many good questions and it was pretty good. Yeah.
Awesome. So I think with that we'll shut it down.
Sounds
Yeah.
good.
We'll schedule another one and then we can there's so much to talk about.
Yeah.
Lifestyle and prevention. That I think that's a big one. In my mind, I think that's a big area when it comes to like preventative or dealing, like managing this, is the physical side of the whole holistic health model, whatever thing.
Yeah.
Diet, physical activity, but they're all important,
Yeah.
right? At the end of the day.
And the mental piece that we often overlook, like we were talking about, right? Like that's
Trauma.
yeah, all of that ties into how and why we eat the way we do. Culture, but not just culture, everything stems from past harms and you know, like it's just so connected.
Yeah.
Yeah.
Mental health. Yeah. Yeah, let's do this daily.
Daily check.
Sounds good. Tomorrow 9 a.m. We're
Yeah,
back.
exactly.
So I think with that we'll end it off there. We'll just have a little quick closing comments, a little round table. We'll start to my left with Miss Ashley, and then we'll come around to Alicia, and then we'll shut it down. And yeah.
Okay. Yeah, well, thanks for having us today. I guess the big message we want to get out, or well, I would kind of be pushing, is that diabetes is on the rise with kids. So be aware, know the signs and symptoms. If you are worried about your kids or yourself, feel free to book an appointment at the health clinic. We've got lots of really talented, really awesome providers that are available, and they're right here, ready to screen. So even if this screening project might take a little bit longer for it to get running in school, bring your kids in anytime. And even and we are often available. We're busy, we're kind of run around sometimes, but we'll make time. We'll make sure that we can get you in. So don't ever feel like you have to wait for a referral. You can self-refer. We want to see you. So yeah, come on in.
Right on. Thanks.
And I think for just what Ashley said too, just making sure people are aware we're there. And I know a lot of times people don't necessarily know what we do in the community, and I think it's important to note that we don't just do in-person visits like in the clinic setting, because sometimes people will come to the clinic thinking they can see us right away, but we're doing other things. We're probably two of the only prevention health workers, like health staff, doing community work. So it's really, we're pulled all over the place. So we're doing all kinds of stuff, but we are there. Like people can get a hold of us no matter what. People know that. Like if you need diabetes help or dietary stuff, we're there all the time. So most people know they can reach out.
Yeah.
And not to be afraid of us. We're very easygoing and we'll help you eat your piece of pie.
Yeah. Yeah.
As long as you include some walnuts in there, some
Pizza.
Protein and some cheese on the side, you're good.
Yeah.
Pizza party after the
Yeah,
next episode.
exactly. Salad on the side.
All right. Again, thanks ladies for doing this, and I'm looking forward to the next one.
All right, we'll book it.
Yeah. And just for the viewers out there, I hope you guys enjoyed this. I hope you found the information useful. And keep an eye out for more of these types of episodes to come with the ladies. I feel like it's an area that we're all passionate to learn more about and kind of get a head start on and all that kind of good stuff. So I think with that we'll shut it down. Thanks everybody for tuning in, and thanks again Alicia and Ashley for coming to do this. And yeah, we'll let you guys go, and we'll catch up again soon. Hi.